Hi everyone, this is Dr. Blake Bloxham, and today I wanted to invite you to do a hair loss consultation with me. So I receive dozens upon dozens of consultation requests on a weekly basis. These are consultation requests from patients who are obviously losing their hair, or they're concerned that they're losing their hair, and they're looking for answers. They're looking for a confirmation. They're looking for, maybe my thoughts on what is causing the loss. And most of the time they're looking for treatment. These are people concerned. They're interested in medications, maybe non-surgical treatments. A lot of the times, because I'm well known for transplants, they're looking for surgical treatments. So what I thought was that if you're following this channel, chances are you're somebody who's probably in a similar position to these patients. Maybe you've reached out to me, maybe you haven't, but having this information might be useful to you, and it might also be a little interesting to see sort of a behind the scenes, like what would happen, what goes through the hair doctor's mind when you submit your information to them and they're kind of reviewing your case. The other reason I thought this might be interesting is I know that there are a lot of people out there that really just become obsessed with the hair world once they kind of start to dive into it a little bit. And I thought it might be kind of fun for people to sort of follow along and play along. I'm going to break this down and I'm going to kind of do some logical stops at certain points and kind of ask, what do you think? What should I do? I do the right thing? Did I do the wrong thing? So if you want to really have some fun with this, you can kind of pause the video at certain points and sort of, come up with your own answer, your own theories, and see if it matches mine. We can talk it out in the comments, all that good stuff. But without further ado, I invite you to go through a hair loss consultation that was submitted to me. So let's jump in and sort of work through this patient's consultation request. So as you can see here, this patient is a 25-year-old male from the Midwest. And he reports that he started to notice his hair loss about 2 years ago with a bald spot forming in the back of his head. He said that spot has continued to increase, and now he's noticing thinning in the front part of the scalp as well. He says that every time he showers, he notices a few strands of hair. And because of this, he started on hair loss vitamins. And he also told me that he is interested, he's reaching out because he's interested in a surgical procedure. And again, that's very common for me. A lot of times people reach out saying, hey, I want surgery, but my philosophy is, let's kind of evaluate the situation, let's figure out what's going on, and then see if surgery is appropriate. So a couple things just that I'm thinking kind of off the bat here. So 25-year-old patient who says he started to notice his loss 2 years ago, so in his early 20s. He also reports a spot, a pattern, if you will, that starts in the back. And then he said that it spreads in size and that he starts to notice it in the front as well. So for me, that's immediately ringing the alarm bell for androgenic alopecia, for genetic male hair loss. This to me sounds very much like classic genetic male hair loss. He's the right age, he's the right sex, and the story, follows what we typically see. I either started to notice it here first and it's kind of pushing back, or I've noticed it here and it's kind of spreading. This is the very classic story that we hear from young men that sort of reach out. So immediately, I'm sort of leaning towards this is a genetic male hair loss. However, we never want to jump to conclusions. We never want to make a diagnosis without having kind of the whole picture. I can't just rely on what this patient is telling me. I need to get some more information. And the best thing that I can get for what I do is some pictures. If I can visually sort of inspect the scalp, I think I can have a pretty good idea of what's going on. So thankfully, this patient was kind enough to share an image. So this is the image that he shared with me here. So let's look at this picture. So when we step back, my immediate thought is that this does correlate with his description of it. To me, this looks like very classic genetic male hair loss. No question, it's worse in this crown region here. With this tilt down here, it also looks to me like he's starting to see some recession in the corners. So again, this is classic. This is probably the first spot we see it with genetic male hair loss. This is probably the second. He also, in these areas where he's seeing the loss, it appears like it's not like completely gone, that it's miniaturizing. He's seeing the shrinking of the hair shafts. He's seeing a lower density of the hair shafts. That miniaturization process is very classic for androgenic alopecia. I also noticed that even though he's sort of describing it here and here, I'm noticing that this mid scalp area, this bridge here, is starting to look a little bit weaker to me as well. When you compare this bridge to this forelock in the front, to me this bridge looks a little less dense. To me it looks a little bit lighter in color, like that miniaturization may be kind of spreading. So at this point in time, I feel fairly confident in a diagnosis of androgenic alopecia. Now, I can't be certain. I would never tell the patient, take that to the bank, because I'm, just evaluating him online. But to me, that seems pretty sensical. I also don't notice any other, red flags. There's nothing on the scalp that's red. I don't see any scales. The patient hasn't reported any patches of loss that are coming and going. He's not reporting any painful sensations, burning, itching, crawling, nothing like that. He's not reporting loss in any other areas of the body. So again, to me, this is all sort of nicely falling into that androgenic alopecia bucket. So the big question, and if you kind of want to stop the video here, and kind of come up with your own plan, is what should we do from here? What's the best thing that we can do for this patient right now? Should we tell him, hey, it looks great, book a surgery? Should we say, you know what, just let it go. Who cares? It's hair loss. What should we do? So what I did was first I confirmed the diagnosis to him. I said, look, I believe this is androgenic alopecia. A lot of the times patients don't fit cleanly on that Norwood scale that you kind of famously see, but I would say that if I had to put him on that scale, he's probably somewhere between what I would call a 3V, a 3 vertex, and a 4. And then the next thing I did was I sort of inquired about his interest or his usage of first-line treatments for androgenic alopecia. Now, he did report that he was using some hair vitamins. That's great. I wouldn't expect any miracles from that, but it's certainly not going to hurt anything. But when I refer to first-line treatments for androgenic alopecia, what I'm thinking here are, anti-androgens and minoxidil. The anti-androgens like finasteride or dutasteride and minoxidil, those are the ones that for all intents and purposes are basically approved for genetic male hair loss in an individual like this. And my thought is that in a young guy like this, we should probably always, start with the idea of preservation and sort of less invasive treatments before we push him into surgery. But, if you're one of those ones who's kind of playing along right now, I mean, what do you think? Is this a guy where you would say, okay, maybe consider taking some finasteride and we'll do surgery? Or is this someone where we should really sort of invest, in as much slowing and kicking that can down the road and preservation as possible? And that was kind of the direction I was sort of trying to nudge him in a little bit. Even though he was requesting surgery here, my gut feeling was that this patient was probably going to be best served by starting with sort of the least invasive path we could take and really pushing, the preservation angle. So that's kind of, where I was leading a little bit. But what did he have to say? This is what I recommended to him. We were just exchanging emails. But what do you think he had to say? If this was you and you had reached out to me saying, hey, Dr. Bloxham, I want surgery. When can I schedule? And I got back to you saying, what do you think about meds? What would you have to say about that? So what this patient had to say was that he's open to any first-line treatment. And if there's something out there that's stronger than the hair vitamins he's currently using, he's game. And to me, excellent, because I believe that there are better things out there for androgenic alopecia, and my recommendation would be to start with those first line treatments, or at least get those first line treatments in place, and that's going to be the anti-androgen medications, either finasteride or dutasteride, and minoxidil. So he also told me, hey, but look, man, I'm still interested in that crown transplant. Let's talk about that crown transplant. So what did I do? Did I tell that guy, okay, I did my due diligence, I'm a nice guy, so let's do the surgery? Or did I still kind of say, maybe we could do this, maybe we could do that? And what would you have done? Or how would you have felt, as a patient? What would you want to do at this point? So what I did was, as much as I love doing surgeries, and that's kind of my bread and butter is surgeries, and I understand the difference they make. I've seen so many patients over the years that are frustrated when they go to see a surgeon and the surgeon immediately says, don't do surgery, have a good day. I get it. I get that he wants to do surgery, but I get that I could probably very easily lead him into a surgery, but I still want to do what's best for this guy. If this guy, I have brothers his age or close to his age. I have, a son. If this was somebody in my family, I would probably be, happier if the doctor that they saw said, okay, we can discuss surgery. Surgery is always on the table, but maybe we can consider some other things first. So that's sort of, what I did is I told him, look, as much as I love doing the surgeries, my gut feeling is let's sort of start, as simple and as minimally invasive as possible, and then maybe work up to these bigger interventions. So that was kind of what I told him. And after a few back and forths, he was still sort of talking about these more invasive interventions. And what I said was, look, I'm not opposed to that. I'm always at least open to having a conversation about that. But something else we could consider, if we're sort of working up this stepwise, progression of treatments going from the least invasive to the most invasive, maybe there's a step between medications and surgery. And I think that there is, and I think that in this instance, that's the non-surgical interventions. And now this is not something I always recommend or I always perform. I actually don't, do this universally on everybody. I think that they can be good treatments, but I definitely think that you need to sort of pick your battles and use them in the right patients. But I do think that this individual would be a good type of patient for something like PRP with PRF. Some of the exosomes, maybe some of the other more novel new kind of growth factor treatments, because I do think it could be a good adjunct to the medications if done appropriately. And I do think that it could put this patient in a situation where we can sort of give him some time to try this other stuff and then see if he still feels the same way about surgery. Especially a young patient that's seeking surgery in the crown. If we were starting here at an appropriate level and doing something conservative, I think that's one thing. But if we're jumping around, a little crown, a little here, a little there, on a young patient who might thin aggressively, and let's face it, a 23-year-old guy that has, pattern thinning here, that has thinning here, and that has some miniaturization, in the middle, he's a patient that could definitely thin, a lot on top. So I think for him, working him up to surgery is the best thing that we can do. So with all that in mind, what happened? What was the resolution of this? What did we end up doing? So this online consultation did lead to an in-person consultation. He came in, we talked about everything, we kind of reviewed all this stuff, and what we decided to do was to start some medication. So we started some oral anti-androgen medications. Typically with patients, I discuss either starting sort of the FDA recommended 1 milligram of finasteride daily, or we talk about doing a sort of more stretched out regimen with dutasteride, 0.5 milligrams of dutasteride 3 times a week. So we discussed both of those. And then we also started a low dose of oral minoxidil. So what we're going to do is give that about 6 to 12 months to sort of work its magic, see what happens, and then we will reassess. So that was that patient's consultation, from the online consultation all the way to the in-person consultation. And this is a really good example and a good case, I think, just to sort of showcase, what goes through the mind of a hair doctor when you submit your information to them and say, hey, what's going on? So, if you were following along with this and you found it interesting, if you want to argue with me in the comments, please leave them below. If you disagree with me on any point, please leave them below. I'd love to discuss it. If you found this interesting, like the video, and I'll do more of them. I think I'm going to do more of these. I think they'll be interesting. And lastly, please subscribe to the channel. This is a new channel for me. This is where I'm going to be doing all of my content from here on out. It's going to be very similar to the last channel I was on. The last channel I built up to about 8,000 subscribers, became very popular. I'm going to do the same with this one. So subscribe if you like this and would like to see more of these consultation videos. I am Dr. Blake Bloxham, and I thank you for watching. I thank you for subscribing, and we will see you in the next video.